Okay, this is morning medicine. I'm doing it late because tomorrow I gotta leave early, so I won't be around at 8 o'clock. And am I live yet? Tomorrow's morning medicine will be. You're now live. Yeah, you said that last time, and I had to do it again. All right, let's just do it. Bunias Orientalis, which is a flower from Europe. Okay, so Prinzing, this thing hopefully doesn't mess up, used the seeds of the Norwegian stock of the plant. So it came from Norwegian. Anyways, Norway. I couldn't think of how to say that. Came from Norway in the homeopathic potencies. His attention was drawn toward this plant after learning that a doctor in the north, I guess in Norway, using Bunias to treat cancerous subjects with interesting results. This thing still says I'm going. You're live now. Yeah, well, don't mess up on me. Dag nabbit. You get interesting results on cancerous patients. There is a homeopathic clinical proving which involved 103 patients during a period of 2 years. So that's how the proving is done. They give this medicine homeopathically. Basically, they get poisoned by it. You get all these symptoms, you write them down, and they followed this one for 103 patients for 2 years. And then there was a series of 40 patients observed for 10 years. So this is quite a decent proving for this plant. Now, there's not a whole lot on it. Um, Come on, man, don't mess up on me. You keep saying I'm live now. Okay, keep being live. Um, but what they did was psoric, which is a miasmatic situation, and allergic constitutions it's good for. And of course, cancerous and syphilitic conditions. The remedy is suitable for tubercular and psychotic types with arthritic, neurotic tendencies, for women with syphilitic afflictions, and especially for cancerous subjects. They're depressed with depressive psychosis, which can end in suicide. So that's what this plan is basically good for. Intermittent attacks of fever, beginning with a fit of shivering at around 11 p.m. at night, chattering teeth, heat, and ending in morning. So I guess they're shivering all night. Tiredness, weakness, loss of vitality, every difficult previously overcome with case ease is now arduous. So every illness, every cold, every flu used to be easy for them to get over, and now they can't. And this is probably a little later in life, as I'll read. Let's see, where was I? Artists and faced with gritting of the teeth. So they're really gritting their teeth. Man. Need to lie down after a few hours of work, so they can't really function good. Cannot stay awake in the evening. The sudden appearance and disappearance of all symptoms. So all symptoms come on suddenly and go away suddenly. Aconite has that with colds, flus, different things. It sudden onset of it, and this one has sudden onset of and disappearance of all symptoms. Rapid emaciation, and that's like to do with cancer of no apparent reason. Precancerous conditions. I guess this thing's going to work. Allergic, psoric, or syphilitic conditions, precancerous conditions, psychological exhaustion. So mentally they're exhausted. Emaciation, so they're losing weight. Itching eruptions followed by adenitis, which is they got itchy eruptions all around, and adenitis is the gland swell, and that's in tubercular. Anybody have a tubercular miasm, their glands will swell. Hodgkin's disease, subacute infections of rheumatic or of the female genital organs. So it's a rheumatic person who has rheumatic pains, but they have acute infections in the female organs. Intermittent attacks of fever, irregular menses, nauseating leukorrhea, abnormal pregnancy, children are weak, puny, premature, syphilitic types, babies born with congenital malformations. So any kind of congenital malformations for a baby. Profuse bleeding after birth with large placenta scars. Bloodstained lochia continuing. So that's lochia is discharge, leukorrhea coming from the vagina, and it's bloodstained, continuing for 3 or 4 months. Vulvar, which is the vulva, varicosity during pregnancy, metorrhagia, which is bleeding during menopause, which is abnormal. Most, I would imagine most ladies during menopause do not bleed. Brachial neuralgia. Brachial is the, I think up in the chest. Let's see. Yeah. Like I said, you know, you don't have to be a homeopath, a doctor, or anything, but thank God for Google, because you can figure this out. Brachial neuralgia. Let's see what it says.
Brachial neuralgia, also known as brachial neuritis, is a nerve condition. It affects the brachial plexus, which is a network of nerves in the shoulder controlling the arm.
The shoulder. Okay. So it's shoulder, nerve pain in the shoulder. That's the brachial. Where was I? Pains which go around in circles quickly change place. So the pains, there's a few medicines that have that, like pulsatilla, things change places. They're very changeable with whether it's the mood or the pains or whatever. Pulsatilla has the same thing. Burning, which is a plant. Burning, stinging, or cramping is the pains. Diffuse nerve pains behind the mastoid process. That's up in the jaw and the mouth and the face. The top of the radius, top of the fibula, and the end of the 12th rib. That's where all the neuralgia is. Neuralgia of the left sciatic nerve. So they have a sciatic is in the left. All right, let's get into the board. Bunias orientalis, an herb that is from Norway, obviously, and found in Europe. So, tubercular and psychotic types. Now, that is, like I said, the tubercular types usually have swollen glands. Psychotic types, skin, rheumatism, all that kind of stuff is psychotic. So they have both going on. Types with arthritic, neurotic tendencies. So neurotic, well, yeah, that's is that the depression? Yeah, neurosis. Yeah, that's in the mind. That's the depression and all that stuff. So, and it says it comes down to suicide eventually. Syphilitic and cancer tendencies. So syphilitic being, like I said, skin stuff and all that stuff. Sore is actually skin. Syphilitic is more mind, and it can be some skin and some joint stuff. But with cancerous tendencies, pretty sure that's the way it goes. Better walking, changing positions. So they're always moving around, changing positions. Arsenicum has that. Aconite has that. There's a few medicines that have, they're just restless, you know, and some are, aconite is more restless of mind. Russ talks restless in body. Arsenicum is, I think, both kind of a mind-body restlessness, and Bunias has that restlessness, always changing positions. Worse at night, overexertion. So anytime at night it gets worse. It's at 11 p.m. The stuff comes on. Overexertion. They can't, you know, like it said, you work for 3 hours and then they're dead. That's it. They're done. I'm still alive. Fatty foods. They don't like fatty foods, and it's worse on the left side, which is you see with that left sciatica. Lightness, the mind, neurotic conditions. So that's that neurosis. They get depressed and everything with anguish and unrest. So they're moving around, and the anguish. That's all mental and physical. They're just moving around. It's probably more mental, which aconite I think is the one that has that. Irrational. They're very irrational people. Lightness, floating, falling into a pit. So they feel like they're floating, but they feel like they're falling into a pit. Very depressive, and psychosis in cancer with anxiety. They have anxiety, psychosis in cancer patients. Abdomen is copious flatulence during the day. So they have a lot of farting going on during the day. Flatulence and what's the other one called in when a burp? There's a term they have for that. But anyways, flatulence is in the anus. They're farting. Back nothing. Feeling of stabbing. Now back should have the sciatica, but it doesn't. Chest. Feeling of stabbing and restriction in the chest. So it feels like there's a stabbing pain and a restriction. I don't doubt on the breathing, but yeah, they feel like they're there's a if you ask somebody, okay, what's that pain feel like? And if they, you have to say, is it burning, stabbing, stinging, throbbing, pounding? They say stabbing, you're looking towards Bunias, and there's a couple other ones, and restriction. In the ears, they have tinnitus, tinnitus. Yeah. Anyways, like bells ringing, or like boiling water in the ear, like something's bubbling. Eyes, visual complaints. They see clouds or black circles. I forget what they call that when you have. I have one every once in a while, a black spot in my eye. There's a term for it, but anyways, these ones have black circles in their eyes, or they see clouds. It's cloudy. Let's see, and temporary amaurosis, which is loss of vision in the eyes. No face. Menses are painful, irregular, flows abundantly or scanty. So either way, it can be either abundant or scanty, but it's very irregular and painful menses, which I think is menorrhagia. Is it menorrhagia or metorrhagia? Those terms are so close. With purplish blood. Now that's interesting. You never hear purplish blood. And clotting. They have abnormal pregnancies, so their pregnancies never seem to go well. Metorrhagia. I think metorrhagia is bleeding. No, metorrhagia is painful menses when with hematoma behind placenta. So they're bleeding during pregnancy with a hematoma, or a hematoma is like a blood clot behind with from injury or something. But this is a hematoma with bleeding behind the placenta. That's what it is. And menorrhagia in young girls. Menorrhagia is the painful one. Premenstrual menorrhagia. So menopausal, premenopausal menorrhagia. So young girls have the painful periods, and the ladies going into menopause, before they go in, they have very painful periods. And with these periods, they have a headache and dyspnea. Dyspnea is before menses. So the headache comes on. They have a hard time breathing before their menses. Valvular congestion, vulvar congestion. So the vulva is congested with eczema, with skin, pimples or rashes or whatever. Leukorrhea is irritating the mucous membranes, and it has yellow or brown leukorrhea coming out and it's fetid. It smells bad. No food. Head feels increased in size, so their head feels big. Coldness in head, stomach, fingers, and back. So all those areas, the head, the stomach, the fingers, and the back are all cold. Heart nothing, urine, irritating of strong odor. So not only is a leukorrhea strong odor, and this is in men also, they have strong odor in their urine. Albuminous, which is protein in the albumin is coming from the blood. Anyways, or streaked with blood. So albuminous or streaked with blood is in the urine. Proteinuria, which is protein in the urine. Indole is the same thing. It breaks down it's a breakdown of the amino acid tryptophan by a bacteria that puts that protein into the urine, and it's in the bacteria in the urine. So when they urinate, they have bacteria, they have protein in it, they have the albumin from the blood in it. So a lot of things and it's very strong odor. I just told a kid he was having a kidney stone. What did I give him? I told him to get what the heck was that? Oh God, it was just yesterday. Uh, I can't think of what it was. Anyways, they said it felt a little better today. Anyways, bouts of rheumatoid arthritis in the limbs. That's that psychotic stuff going or syphilitic stuff going on with swollen joints. Now, swollen joints can be a few different ones. It could be bryonia, it could be apis, it could be restox. It could be a bunch of different ones. But they have that rheumatoid arthritis with swollen joints. You'd have to match some of the other things going on with them to pick which medicine would be Bunias, restox, bryonia. And of course you just ask them simple questions. They've got this rheumatoid arthritis, and is it better by motion, worse by motion? All kinds of different things to differentiate these different medicines. Apis would be red and swollen. Belladonna could be another one. So there's a few medicines that you would have to differentiate between the symptoms to figure out which one would be best for that person. Localized edema. Edema is fluid retention, and it's localized, probably in the knee or whatever joints swollen. Localized edema coming and disappearing suddenly. With this medicine, everything's coming and disappearing suddenly. It says I'm still live. This thing says, now you're live. I've never seen that before. Hopefully this is recording. But all the symptoms come and go suddenly. They come on suddenly, they go away suddenly. There's a couple medicines that have that type of thing. Coccydynia, which is tailbone pain. I would think about hypericum there. Anybody hurts their tailbone, a lot of nerves there, you'd think of hypericum. But if they just constantly have a pain, it could be hypericum, but you'd be thinking about Bunias. And I'd be honest, I never even considered this medicine. That's why I love going through this, because all these different medicines, if I'm doing hypericum, and when I'm looking at this coccyx pain and I see Bunias in there, that'd be another one that I would consider if hypericum's not working. Let's see. Oh, this localized edema coming and disappearing suddenly is on the back of the hand, collarbone, and axilla. Axilla is the under the armpit, is the armpit basically. But that's that edema, that retention of fluids, which causes the thing to puff up and become swollen. It comes and disappears suddenly, but it's on the back of the hand, collarbone, and axilla. So here, the axilla and the back of the hand. Let's see, liver nothing. Sharp, sudden hoarseness. Now this is in the lungs, so they get in a hoarseness. And of course they have asthma appears suddenly at age 40, which is weird. Now that's what they were saying. They said the things you used to be able to overcome quickly, all of a sudden you can't. And this is one of them. They all of a sudden have this asthma situation that appears at the age of 40. I don't know if it has to be exactly 40, but later in life. Wheezing, respiration. So they're wheezing, they have hoarseness, asthma coming on. Dyspnea, that's hard to breathe. Pain in left side of sternum, up in the chest there. So they got a pain in the chest. And of course the chest was stabbing pain with restriction. And that restriction would be kind of that restriction would have that pain in the left side. Lungs, okay, I did that. Male, no mouth, no male, no nose, right? Stools suddenly. Yeah, rectum. Here's rectum. And this is all rectum. Stools suddenly turn to diarrhea. So there's a suddenly again. Like I said, things will come on suddenly, go away suddenly. This stool comes on suddenly and turn to diarrhea, lasting 2 to 3 days, then goes back to normal, which is very interesting. So it comes on 2 to 3 days at last, then goes back to normal. They can also have attacks of constipation with hard stools, difficult with nausea. So these stools, when they're hard, they have this nausea. It's very difficult to go to the bathroom, and they get nauseous. Tendency to sudden appearance of hemorrhoids. So there's that suddenly again. If symptoms are coming on suddenly, whatever they are, hemorrhoids, diarrhea. What else was suddenly? The asthma. There was another suddenly here. Suddenly, edema, localized edema on the hands, collarbone, and all that, and axilla coming on suddenly. Is there other suddenlies? There's some more, but that's one of the traits of this medicine is things come on suddenly. Eruptions of red spots or vesicles on the skin, red brick or purple color, located on nose, cheeks, thighs, legs, forearms, and palms. It's interesting how each symptom that you have with this medicine, Bunias, Bunias, yeah, Orientalis, things come on suddenly, and they have localized stuff, localized edema, which is on the collarbone, axilla, back of hand, and they come on suddenly and disappear suddenly. And this one here with these vesicles and red spots uh, on the skin comes on the nose, cheeks, thighs, legs, forearms, and palms. Doesn't leave a whole lot of stuff out, but yeah, it's interesting how this medicine has different areas that it attacks. Vesicles on the tip of the tongue, so they'd have these painful blisters on the tongue, periphery of on the tongue, periphery of mouth, and anus. So it sounds like a lot of the mucous membranes there, but the mouth, anus, and tongue. Itching eruptions aggravated by scratching. So when they scratch, it just makes it worse. Huh. I've been having that a lot. I've had scratching on my forearms. Does it say forearms? Yeah, forearms, thighs, legs, palms. I don't think I have that medicine. I wouldn't mind trying it because I've had these. I don't know what the heck they are, but I scratch them until they basically break open and bleed. Then they scab, and then another one appears. I don't know what the heck's going on. And it could be, with me, it could be the body pushing out something. I've been bit by a lot of ticks. I think we had some fleas a little bit ago because of our 6 cats and 1 dog. And we bombed the place. But afterwards, I had this rash, or this stuff that just, they don't, they're under the skin, but they're very itchy. Once I start scratching them, it's worse. So aggravated by scratching, and that's what I'm getting. Itching or pruritus, which is itching, malignant adenitis, inflammation of glands. So malignant is cancerous gland inflammation. And that has to do with the tubercular miasm situation. Sleep, light disturbs, wakes frequently, tosses and turns. This is that anxiety. This is that psychosis. This is that can't get settled. Tosses, turns, exhausted in the morning. They got a lot of tossing and turning they're doing, and they're exhausted in the morning. In the stomach, they have weakness and vomiting. So, yeah, that's stomach situation. Thoracic pains on the left side, and this has to do with the throat. Yeah, between 11 and 12 p.m. So there's a night aggravations with shivering, fever every 21 days. I don't know what kind of, I had a quatrain fever was every 3 days, I think. So there's Teratian fevers. There's a few different fevers. They don't have a name for this one here for some reason, but every 21 days they get this shivering, this fever and the shivering. Well, the shivering comes on 11 to 12 p.m. But the fever is every 21 days in short attacks. So it comes on and they shiver and they have a fever. Every 2 to 4 hours after shivering, sweat soothes. So after they shiver, after they have their fever, after they shiver, 2 or 4 hours later, after shivering, they have a sweat come on and it soothes them. Vertigo with feeling of uncertainty coming suddenly. There's that suddenly again. Last short while, early in the morning. So they have this vertigo that they get, and it's comes on suddenly, and it's they have this feeling of uncertainty of what the heck's going on, and comes on early in the morning. All right, so most things are worse at night. Now here's some interesting stuff. I'm just gonna do this because I don't have a lot else here. Sure hope this thing takes. Baptisia, that's another medicine, considered nervous depression, face is red, bewildered. So it has that, like I said, with that uncertainty in that. They're bewildered, extreme agitation, putrid smelling breath, fetid diarrhea, all the same symptoms as Bunias, but Baptisia is a little different. Livid marks on the body and limbs. So there's that skin stuff. Symphytum's comfrey, right? Yeah, comfrey, and it's bone break, so it's good for bones. Pain in the bones at night, appearing and disappearing slowly. That's the difference, because this one comes on suddenly and leaves quickly. Symphytum appears and disappears slowly. Breath is fetid, that has the same thing as this one. Painless constipation or diarrhea in the morning. Profuse, acrid, yellowish leukorrhea. Where's the female? The leukorrhea is yellow or bronze. So a lot of similar stuff with symphytum. Just like with baptisia, it has a lot of the same stuff, but there's a few things that you would differentiate it with. Changing moods, difficulty in assembling thoughts, loss of memory, especially for proper nouns. So this is a differentiating between these medicines. How much time do I have? 25. Yeah, I can differentiate a little. So the yellowish leukorrhea is the same. The constipation diarrhea is the same. The breath is the same, but the disappearing and appearing and disappearing slowly in symphytum is different than, what's it say? Where the heck is that? It suddenly comes on, suddenly coming suddenly and disappearing suddenly. So it comes on and disappears, where symphytum disappears and comes on slowly. So that would be the way to differentiate those two medicines if you are considering them for a certain situation, and you don't know which one to give. So the same thing with baptisia, putrid smelling breath. Let's see, the mouth. Attacks of constipation appearing morning. Where's the breath? Things are smelly. I'm pretty sure there's some smelly there. I'm not going to. Face is red, bewildered. There's that bewildered with baptisia. Same as this. Extreme agitation. That's the same that Bunias has. Putrid smelling breath, fetid diarrhea, smelly diarrhea. Considerable nervous depression. It has all the same things. Face is red. What's the face? No face on this one. No. How would you livid marks on the body and limbs? I don't see a whole lot to differentiate that medicine from the Bunias. Okay, arsenicum is another one you would consider with Bunias when you're looking up some symptoms, looking up a condition for a person. Rapid prostration, anxiety, agitation. So it has all that. Cadaverous odor, same thing there with Bunias. Of the secretions. Aggravation at night between 1 a.m. and 3 a.m. So that could be different, because this one says between 11 and 12 p.m. and this one says 1 a.m. to 3 a.m. So that might be the differentiating factor with arsenicum and Bunias. Sequela, hemorrhage of black blood, which female for Bunias says the blood is purplish blood and clotting. So this one says hemorrhage of black blood in exhausted woman. Postpartum hemorrhage. Postpartum is after the baby. After they have a baby, they have the bleeding. What does this one say? Abnormal pregnancies is all it says. Does it say anything about bleeding after placenta? Hematoma behind placenta. So there could be some bleeding there with the having a baby. But this one has postpartum hemorrhage, which is what arsenicum was it? Has. Yeah, or no, sequela has. Okay, so that's Bunias orientalis, and then Monday is Buthus australis, which is scorpion. So Monday we're going to do scorpion, and that's probably the only one, because butyritic has a lot to it too. And then we'll be into the C's, and the first C is cacao, coca, coca, which is chocolate. All right, so that's morning medicine at night, and Bunias orientalis, and as usual, you can age, but you don't have to get old. The only way to do that is to eat right, move right, and take care of your stress and things in life. Life's too short to be stressed.